This is Logan Sekulow. The COVID-19 vaccine rollout seems to put prisoners over grandparents.
Live from Washington, D.C., Jay Sekulow Live. Phone lines are open for your questions right now. Call 1-800-684-3110. And now your host, Logan Sekulow.
Welcome to the one and only flag-waving, God-praising, trail-blazing, heck-raising radio show. It's the Logan Sekulow Reprogram takeover of Jay Sekulow Live. Will, welcome back. We're here today.
Twice as nice this
Gone
week.
tomorrow.
There you go. That's a weird way to put it.
That's true.
I mean, it's accurate.
This is
but
our
it's just
last
a weird way to
takeover
put
for
it.
the week. We're happy you're joining us. We have some really interesting news. There's a few topics we're going to get to today, but we wanted to kick off the show with a report that just came out today in the last 24 hours that will be about the priority system for the coronavirus vaccine. Now, we've heard, obviously, this morning the UK becomes the first first place to approve it. With
Right.
their version of the FDA has approved the vaccine.
Pfizer vaccine.
The Pfizer vaccine.
Specifically, right.
It will start being distributed next week in the UK, which is, big, huge news. But here in the U.S., some documents came out that are, again, showing the priority list of who will get this vaccine first. And one of the big surprise one is that prisoners, because of their confined living space, will actually outrank, if you will, those who are 65 and over with medical comorbidities or anything.
Even just 65 and up,
but even,
and others.
and the ones that
right.
also have it. So understand, yes, there's obviously there's going to be a rollout. We always knew there would be a rollout where you thought, well, the people who are the most vulnerable will get it first. You'll see the nursing homes get it. You'll see people who are in there. And really, I thought then the next step is people who are 65 plus, especially those who have other medical conditions. But it seems like there's actually quite a list of other people who will get it potentially before then in certain states. And some of that includes prisons that are getting it first.
Right. So what we're seeing is states are starting to release their plans of how they're going to distribute the vaccine because they will be working with the companies.
It's going to start soon.
Adding a priority list. They're saying within 2 weeks in the United States, it could start rolling out. And since it's already been approved in the UK, you can only assume that we will be soon to see an FDA approval here. But what's going on is that the Colorado plan actually is what spiked this in the news, is that they have, the phase one are frontline workers, doctors, nurses, healthcare workers, and high-risk residents and patients in like assisted living or long-term care or nursing homes. That all makes sense. Okay, the doctors and nurses, one, because you don't want them spreading it to other people, but also because you need them to help care for the infected. But then also the long-term care and nursing home facilities. We know that has been one of the hardest hit communities.
Absolutely. Especially
Especially in the Northeast. You've seen how many people's lives have been lost to this virus in those demographics. But then you get down in Colorado's phase 2A. It's people who live in congregate housing, including those who are in prisons, and essential workers will receive the vaccine.
Again, and I didn't throw that in there. Essential workers, totally understand as well. Doctors, nurses, people who are coming in contact
and this
with
is specifically in a communal living type situation. So if it's maybe a essential work that's infrastructure where they have barracks or something, or maybe even like firefighters that may be in a community living because they stay there at the firehouse overnight. But then after 2A, you get adults that are 65 or older, or those with heart disease, active cancer, or other underlying health conditions. So
we know the first batch that shipping is not large. Like we know that it's going to take months. Like they're saying for everyone who wants it to get it, it's going to be by the summer, which is still remarkably fast. But the fact that these first batches aren't going to the people who are really maybe the second most vulnerable in this situation. And it's really bizarre. It's a really bizarre thing. Look, we're staying on top of that. I also wanted to thank you all who gave yesterday to the ACLJ on Giving Tuesday. It was a record day again. We really appreciate that. Again, you can check out our work, Still a Matching Challenge at ACLJ.org. We're also going to talk about Supreme Court to rule on the Kentucky religious schools that were shut down. We're talking about that and more coming up on the Reprogram Takeover. Jay Sekulow Live. Welcome back to the Logan Sekulow Reprogram takeover of Jay Sekulow Live. Sorry, they just put a soundbite in that comes from the District Attorney of Colorado. I think we should lead with this.
Yeah.
This is definitely a little intense. Fair warning. I'm going to tell you this before we air it. We're talking about in the last segment, we talked about the fact that Colorado, as well as other states, have rolled out their plans for the COVID-19 vaccine distribution. Who's going to get it first? We always thought, obviously, people who were frontline workers who are exposed to it all the time. Next step, maybe the people in nursing homes, and then people over 65 who have specific issues. And the UK did unveil their plan. We'll talk about that after you hear this, though. This is coming, again, from the District Attorney of Colorado, just said this on Fox News.
The governor had cajoled people before Thanksgiving and said, if you have an extended family Thanksgiving, it's like putting a loaded gun to grandma's head. Ironically, his health department's plan would give the vaccine to the guy who puts the loaded gun to grandma's head before it gives it to grandma. That makes no sense.
What do you think about that, folks? Of course, Kentucky, has been really interesting this whole time. I love Kentucky. I love the people of Kentucky. Your governor.
The governor's got some criticism.
Not my favorite. Not my favorite governor. Not in my top 49, maybe. But, here's
do you rank your favorite governors?
I do.
Is that the way you do it?
I think I would rank governors.
You do?
I think so. I don't know.
I want to hear your
top
five.
Top five?
If you've ranked them. I'm putting you on the spot.
Yeah. I know Bill Lee.
Yeah.
Tennessee. He's like a strong, win, play, show. Top 3 somewhere in there.
You probably like DeSantis in Florida.
Like
DeSantis, yeah.
I like, Kay
Ivey in Alabama.
I know the guy in New York.
Cuomo. Is he
Cuomo?
your top 5?
No, but I know his name.
Recognition.
I know his name, so that gets him pretty high up there.
Yeah.
Like if I was doing a fantasy draft, I'd be like, well, I know the name.
Right.
He's got to be decent.
He may be the kicker.
Yeah.
Yeah.
He may be Golden Tate, but I don't know. I feel like it's that. Well, you can give us a call. Hey, 1-800-684-3110. I want to hear your thoughts on this. But also, not only what was going on there, but the UK, in a big move, first country again to authorize the vaccination, who said their version of the FDA said, good to go. Let's start. They're going to start next week. Now, they rolled out their plans for distribution, and it's, more logical, if you will.
Right.
So what is theirs?
Well, and they obviously have a centralized system as opposed to ours, where each state has their own health department.
And a lot less people. I saw some people complaining about, how come the UK gets it first, and how's that work? Well, one, they approved it first, but two, you're talking the difference of hundreds of millions more people in America.
And also the vaccine makers have already started shipping vaccines within the United States, so they're going to be mobilizing for it to be ready as soon as it is approved to start giving out the doses as are prioritized. But in the UK, here is their system, which makes a lot of sense when you think about this whole time we've been hearing follow the science, need-based, help those that need it the most, and take those kind of precautions. But their rollout starts with people in nursing home, and then it's followed by those 80 and over and frontline health and social workers. So actually the nursing home is their top priority. Get it in there, and then they're going to go to the people who are most at risk based off their age and the frontline health and social workers. Then it filters down to the general public by age, with the older groups coming first. So they're strictly doing it as the at-risk populations, it seems like
you'd expect,
over just groups of, they live together, so let's go ahead and do that. Now, I get the concept.
The concept makes a lot of sense.
It could be spreading, but this whole time, the scientists and those that have been telling us how to manage this are to take care of the at-risk populations, and the at-risk populations are those that have more age and maybe a comorbidity. And that's why it just doesn't make sense when you look at the Colorado plan.
Of course not. Hey, give us a call, 1-800-684-3110. Give our phone screener, a nice time. Don't give him a hard time. And, tell him, we get some people up there, I understand. It's a touchy subject for some people. I understand the situation here. He just gave me a look. But I want to hear what your thoughts are, not necessarily on the vaccine, on the concept of this rollout. And also we're going to be moving into talking about what's going on also in the state of Kentucky, Will.
That's right. So in Kentucky, you referenced the governor there, Andy Beshear. And Governor Beshear he's taken a lot of very aggressive lockdown type measures throughout this entire pandemic.
Yeah, we have a lot of friends in Kentucky who complain a lot about what they're seeing there.
And some of them are very arbitrary, like hotels and restaurants are open to specific things, but like coffee shops are shut down. So they're like delineating between specific types of businesses and things like that. However, what the governor of Kentucky, he had shut down in-person classes in the state. And Christian schools had filed a lawsuit saying that basically that wasn't the authority of the governor, that's a violation of their First Amendment ability. And they have filed a lawsuit, and it started as lawsuits do in the district court. They won there. And then the circuit court overturned that decision. Now the Attorney General of Kentucky is getting involved, and he's become kind of a rock star in the conservative communities. He's a Republican as opposed to their Democrat governor, and he actually spoke at the RNC. So this is the Daniel Cameron is their Attorney General. They're trying to take it to the Supreme Court and get the Supreme Court to say you can't shut down the Christian schools.
We saw how they voted with churches in that situation in New York
just last week, right? So
there's a case to be made here for sure. I think in a lot of these situations you go, well, is this just someone grandstanding? Well, I think in this specific instance, maybe not. And there could be a interesting ruling. Now, is there a timeline for this? Do we know any details about what? Because schools are obviously back. Some are back, some are not. Some people are virtual right now.
Well, the order from the governor that included the shutdown of all schools to in-person learning was November 18th. So this is moved fairly quickly going to the district court.
So maybe by next semester.
They got to stay there at the district court of the order, and then that's when the circuit court overruled it. I could see it being an emergency situation at the Supreme Court like the one in New York that related to worship, in-person worship. I could see it moving quickly.
Whether they could shut down churches for in-person worship.
And it may be like kicking it back down to the district court to hear arguments or something, but leaving a stay in place. We'll see what happens.
Hey, I know a lot of people are commenting. We're going to get some of your comments and some of your calls coming up. I did again want to say thank you to everyone who donated yesterday during Giving Tuesday. It was really a big day for the ACLJ. I was monitoring it all day, and a lot of really great people who sent their support. Some people directly, even through Bald Beagle, through our kids channel. So I appreciate that as well. If you haven't watched, we're working on the next video now. That is a project of the ACLJ. As I said yesterday, 2021 is going to be dramatically different for a lot of reasons. But some of that is the content we'll be producing, some of the people we're going to be working with, and some is who we're talking to and why we're talking to them. And when I mean that, I mean as an audience as well. So you or your children or your grandchildren, we think it's very important to be that, that channel, if you will, to educate you, your kids, to keep you informed, to entertained on your core values, your core American values, your Christian values, and make sure that we are there with you at the ACLJ. And what you can do is go to aclj.org right now. Not only can you read incredible blogs, hear great stories of what's going on, see amazing videos that are put together by what I think is the best media team on the planet, really. I think we put together a dream team, an all-star team that puts together content every day, multiple times a day. So make sure you're always engaged. You can do that by liking our pages on Facebook, or following us on Twitter, or following us on Instagram, or even checking out really our YouTube channel, where we are putting a lot of great content on our YouTube channel. And again, I've always felt that it's important as the organization to not just exist where your audience is. So people say, Logan, we're here on Christian radio. Hey, we're on conservative talk radio. I think that's great. I think that is obviously key to the support that you guys give the ACLJ. However, I think it's also important is to be that light in the darkness in places where maybe you're going to find people from all walks of life who aren't turning in to conservative radio. You never know what they're going to find. And that's what we did even with Bald Beagle. I said, we got offers to put it on exclusively on streaming services that are catered towards families, and we may still expand to those. But I want to make sure that the core content is there for free for kids and where they are, and that's on YouTube. So we've done that with Bald Beagle. We're now doing that with ACLJ. I have a channel, Logan Sekulow Reprogram. You can find that. We put up shows and clips every day. Yesterday we did like 3 or 4 clips, plus Will and I went live. You can find that again on our YouTube channel. That's on Logan Sekulow. Just type in that, or Logan Sekulow Reprogram, and you'll find the channel. Subscribe on all those channels. Ring the bell, because then you get notified whenever we put up a video. And again, we do that multiple times a day. And really great content. And again, 2021, You thought 2020 was crazy. 2021, we have some amazing plans coming up for you. You need to take a look at it. Again, thank you for listening, and thank you for supporting our work. This is December. It's the most important month for the organization. It's when most people give, just in general. So aclj.org, take a look at that. You can donate today as part of our matching challenge. Donations are doubled. So I know that can throw some people off. What that means is there's someone on the other end who will match your donation. So someone gives $20, that becomes $40 to the organization, which is amazing, and we appreciate that support. When we get back, we're going to talk a little bit more about the vaccine. We're going to talk a little bit more about these Kentucky religious schools, and we've got some other stuff coming up, Will, too, right?
That's right. We got some stuff from the Attorney General of the United States.
So we're going to do that coming up. And again, phone lines are open for your calls. 1-800-684-3110. That's 1-800-684-3110. We'll be right back on the Reprogram Takeover of Jay. All right, welcome back to the Reprogram. Logan Sekulow Reprogram Takeover. Jay Sekulow. We're going to go jump right into the phones. A lot of people have called, and we're going to try to answer these questions.
And some from Colorado as well. We've got some callers.
We love Colorado, so let's go ahead and go to Colorado.
Let's go to Joyce on line 2 in Colorado.
Hi, Joyce. You're on the air.
Hello, gentlemen, and thank you so much for putting Colorado out there, because we have an idiotic governor that has said what he said with the people from jail. We also have,
Yeah.
How do I want to say this?
It's okay. Look, I understand. Take a breath. It's fine. If you want us to answer from that, we can. Go ahead, though.
We also have the sheriffs that have said the same thing, because most of the people in jail are only there for 17 days or later. So, it's ridiculous.
That's interesting. That's an interesting fact. It's like a bonus for going to jail.
Jump ahead
like if you're
going
to do like a minor crime, you're like, well, I really want to get this vaccine early. So like you'll
Logan
just go in.
Not suggesting anyone do that.
No, that's just an odd statement. It is odd. We're talking so much from Colorado. A guy running one of our video thing, he's wearing a Broncos thing, staring at me right now.
Go.
So I saw the Broncos win the Super Bowl in person. So
there you go.
I was not going for them, but you know what? I was there. Joyce, it is crazy. I'm glad that you are making news. Is this a big story for you guys in Colorado? Is this like the number one headline? Because we're seeing it sort of casually throughout the news here.
Are you kidding me? It's the mainstream media. If it wasn't for Facebook, if it wasn't for some of you guys, Sean Hannity and people like you guys, I would have not had any idea at all. But these guys that are getting this are out in 17 days. It's a double whammy. They get out of the jail, and you have no clue at all where in the heck they're at to give them that second one.
Oh, that's the other point, too, because it's 2 weeks or 21 days, depending on the vaccine. After your first dose, you have to get the second dose. So I don't feel like a lot of people that maybe were, as Joyce is pointing out, they were in jail getting the first dose, and then they're going to go back to their former residence.
Yeah, I'd like to go back to this prison to get, what do you got to do? I got to do another minor crime.
And so at that point, then it's probably a wasted dose, and so it could be a large population receiving a wasted dose
theoretically,
of this.
All right, well, Joyce,
jumping ahead of that.
Joyce, thanks for calling. We're going to move on to some other calls, but we appreciate you giving us a call and obviously giving love to us and to Sean Hannity, which we're all for. Sean's been on this show before. Obviously, we're good buddies, so that's good. Will, you want to move on to another call?
Yeah, let's go to Steve, also from Colorado, on line 6. Steve, you're on the air.
How you guys doing?
We're doing well.
Right.
I have a question. I live in Colorado, unfortunately. Anyway, I have a relative that's a nurse in a nursing home, and it seems like when the people that are in the nursing home or the staff get tested every other day and they test positive for the virus, they're out for 2 weeks.
Yeah.
And when they come back to work, all they say is they had a headache.
Yeah, Steve.
That's all the symptoms were.
Yeah, I know, Steve, you've mentioned, you kind of said, are they going to be required to take this vaccine? I think it's probably going to place a business
up to the employer.
Yeah, employer,
to
just kind of like some of the, people have talked about the mask mandates a lot. And a lot of this, regardless if you had a mandate or not, and where we live, it's like this. Whether you're under a mandate or not, a lot of the businesses, stores, restaurants are requiring it. So I feel like that's probably going to be, I don't know. It is odd to make that requirement, but I know, hey, for certain schools, I know that certain vaccines are required.
Right.
I mean, whether it's the chickenpox or some of other vaccines that you get when your kids are little. So though this is a new vaccine, they could say, hey, yeah, I mean, you don't have to get it, but you also don't have to shop at my business. You don't have to fly on our airline. Ticketmaster, we know, has put out sort of what their thing is to prove that you have the vaccine.
Right.
A lot of people have issues with that. But there are going to be those private business. And look, I'm big into private businesses being able to do kind of, whatever they want in terms of rules. Obviously there are
and as well, if you're a frontline worker that's in, say, an assisted living facility or a nursing home,
you're making that decision
I could
somewhat.
see the business saying, "Listen, as a business, we're making a decision because our customer base, our clientele that we serve, are all at risk." And when you see what happened in New York, when you see what happened in many other places in the country, the hardest hit community is the assisted living and nursing home community because of the congregate living situation and all at-risk demographic of people that have comorbidities and the age factor working against them with this virus. Yeah. And so I could see. Now, I don't think that's going to be maybe a state mandate. In some states, it could, where a governor's like, if you're working at this place, then you have to get that. And I think that could also bring up legal challenges of dictating how the hiring practices work. But I could see most businesses in that instance say, if you're working with patients that are at risk, you're probably going to
You got to do it, unless you have some sort of, reason not to.
Right.
Or medical reason. Let's quickly take Janice in Illinois. I think that's an important call. Jealous in Illinois on line 4. Janice, we only got a couple minutes left, but I wanted to get to your comment.
Sure. I just wanted to comment on the prisons. My son is in prison. He's very young. He did something stupid, but he's a good kid. He's been in there for a year. He's got a couple more to go. They are locked in their cell for 23 hours a day. It's with another person. There's not enough for them both to stand up at the same time. He's gained a lot of weight. We haven't been able to visit him. He gets out for 1 hour a day to take a shower and make a 20-minute phone call.
Look, I think, Janice, I understand your comment. You say he needs the vaccine too.
And that's the concern of the prison, saying that they're trying to not have people interact, I guess, to limit the spread within there.
What I think we need to clarify, Janice, I think your points are valid. I'm not belittling that and saying there aren't good people who are in prison or made a mistake and are that's why they're there. They're somewhat atoning for it, if you will. Should there be prison reform in these situations? Absolutely. I'm very much in for that. But also, Janice, when I look at your situation, and I do have to, though, go say, does that person get the vaccine before the people, though, who are at most risk when it becomes this, which are people who are over the age of 65, specifically those with medical risks. And though I appreciate the fact that you think that this should be the way it is, and look, I understand it will get there. It should get there. It should get to prisons. I'm not saying that prisoners shouldn't be vaccinated.
Right, 100%.
That's insane. I'm not saying that. I'm more saying if we're going to start listing on who gets it first, those who are in prison shouldn't be, in the top first to get this. This needs to be people who really need it. And then we'll work our way there.
Right. Limit the spread in the at-risk communities and save lives in those communities before then just picking and choosing populations that may have a spread risk, but not necessarily a life risk.
Yeah. And if you wanted to say, hey, prisoners who are over this, that's at least another caveat.
Across the board, you're going age
yeah.
Everyone,
down, if you're over 65 and you're a prisoner and you want to get, I think that's a different situation. That's a totally different situation. Hey, we're heading into the second half hour, Jay Sekulow Live. We're going to talk more about this situation going on, whether it's the Kentucky schools going to the Supreme Court to try to get reopened religious schools, whether that is the vaccine going to prisoners before it goes to your grandparents, or maybe your parents would be close to my parents' age. I think that's an important topic to talk about. We're also going to talk a little bit about what's going on in the political world. Will, what's going on? Something coming up from our Attorney General. So you're going to hear that coming up in the next half hour. And we're going to be talking that and more. You can give us a call. I want to hear your thoughts. 1-800-684-3110. Support the work of the ACLJ at aclj.org. Subscribe to our channels, youtube.com. Look up ACLJ, the official ACLJ channel. Subscribe there. Subscribe to the Logan Sekulow channel. I'd appreciate it. Just go to youtube.com/Logan Sekulow Reprogram. And we'll be right back with more on Jay Sekulow Live.
And now your host, Logan Sekulow.
Welcome back to the one and only flag-waving, God-praising, trailblazing, heck-raising radio show. It's the Logan Sekulow Reprogram takeover at Jay Sekulow Live for the day. Thank you for listening. A lot of phone calls are coming in. We're talking about a host of different topics. So we're talking about the Kentucky religious schools taken to the Supreme Court to see if they can reopen. We're talking about the UK, the United Kingdom, getting the vaccine first. They're going to have it next week. And look, they approved it. Their version of the FDA has now approved it. I think that's a big step forward for medicine. Look, I see your comments. I understand some people are for it, some people are against it, but regardless, I think this is a big step forward for the world getting back to opening up in full, especially in those countries. And we're looking at maybe 10, 15 days until the vaccine starts to be delivered to people within America. And that's the big question. Who's getting it first? Why they're getting it? So we've obviously talked about now in Colorado, you're seeing in certain states in Kentucky, you're seeing people get lined up to where before your grandmother can get it, before your mother even most likely, or before you could get it if you're listening to this over 65 years old, it's going to go to the prison systems first, and other confined living situations. So we obviously think that's ridiculous. We're talking about that. We're going to be going through a lot of this, Will. Let's touch a little bit on what's going on. And look, the Attorney General, Bill Barr, has been making news a lot. But hey, this is an interesting piece of news about the Russia hoax.
That's right.
And how things will be protected coming forward.
So we've all been anxiously awaiting anything coming out of the U.S. Attorney John Durham's office as he's been looking into these matters regarding the Russia hoax and the potential crimes that were perpetrated against the Trump campaign back during the 2016 election. Now, we already know that his office got a plea from an individual that had doctored the emails. We've been over that exhaustively on this show of how that is kind of a signal that there's probably more to come as well. Well, back in October, the Attorney General sent a letter to Lindsey Graham, Dianne Feinstein, Jerry Nadler, and Jim Jordan, the respective judiciary committees in the House and Senate, notifying them that he elevated John Durham from just an assignment, the U.S. attorney tasked with looking into this. He appointed him with the powers and authority of a special counsel.
Yeah,
so
you've heard that phrase a lot.
He used the same part of our law, the Code of Federal Regulations, to elevate him to the same level as what Bob Mueller was during that special counsel investigation. And the key here is that a lot of people may have been afraid that this is just going to wrap up, that we're not going to see justice to people that have broken the law and no accountability. But this gives protection, regardless of who's the president in January, to this office, that you can't just remove him from this assignment. He's special counsel looking into this, and it would only be for misconduct or some higher cause that the Attorney General in January could remove him from that. And so it looks like that now special counsel Durham is going to be able to continue that work.
So that's big news, guys. If you're listening, I think you'll enjoy that as we see the continuation of what feels to be the endless Russia investigation and hoax, but it is what it is.
We
want to keep you updated.
COVID-19 and the virus and pandemic did push back a lot of the in-person work that investigators needed to be able to do this year, and that has been cited by the Attorney General that it pushed it back.
One of your favorite people, Adam Schiff, he had something to say about this. Well,
he did.
I think so. Can we hear that by 11?
The appointment is not consistent with the language of the statute that he's relying on and can be rescinded, I think, by the next Attorney General. I would presume the next Attorney General will look to see whether there's any merit to the work that John Durham is doing and make a rational decision about whether that should continue at any level.
Well, there you go.
Adam Schiff always seems to have his facts wrong. It was fine when there was a special counsel that under that law, under that statute, Bob Mueller could not be even looked at or questioned.
In our chat with Bites, it says Representative Adam Schiff, Republican of California. I think that's a typo. It's a typo, guy.
Yeah.
I don't know.
I don't think he's a Republican.
I haven't looked into it specifically, but I think I have a feeling.
I blame the call screener.
I've heard of Adam Schiff before, and I've seen his point of view. And unless he's a Romney, I feel like not. We'll be right back with more on the Reprogram Takeover. Welcome back to the Reprogram Takeover. Voice crack there. Logan Sekulow Reprogram Takeover of Jay Sekulow Live. We do have a lot of calls coming in. Let's go ahead actually and take this call. It's coming from Indiana.
That's right. Diane from Indiana on line 5. Welcome to the show.
Hi, how are y'all doing? Thank you for taking my call.
We're good. How you doing?
And good. And well, I know that they're usually very healthy, but has there been any talk of the U.S. military, the active duty military? Obviously, they all live together in the barracks and on ships and whatnot.
Sure, I think that is addressed, right?
Well, so it is interesting because I almost wonder if the Department of Defense maybe has a different set of rollout plans or something that are outside of the state plans. But there are, as Diane brings up, there are multiple military bases in Colorado. So specifically in this plan, it doesn't say military, but it does say workers living in congregate settings, and it says et cetera by that. So it doesn't delineate every single person in that, but it seems like it would fall in kind of the same category as the students living in college dorms or other congregate housing, or the incarcerated adults.
So it seems like they would be there.
It's that 2A congregate housing essential workers category.
A comment came in, and I'm not going to call you out by name. This is on YouTube. And they said, well, grandma can just stay home and isolate herself. Prisoners are crammed up against each other and need protection. I feel like that is, precisely the problem here. So you're saying those who are elderly can just stay home. We need that at some point we're going to have to reopen. Everything has to reopen and move forward. And if you're saying the people that are most vulnerable, and probably the most that are having issues with the fact that you're being stuck at home, again, if you're 35 and stuck at home, I feel a little less bad for you than if you're in your later years, potentially spending your last years on earth crammed up, at home without being able to see your family. If those people can get the vaccine first, that's who it should be. If someone who's 65 and over can get a vaccine first, that's who it should be. It should be the people, not the people who, yes, you understand. Look, I'm not saying prisons shouldn't get it. I'm just saying, look, if you look at what the first batches that are coming out in the next few weeks, you're not talking about millions upon millions upon millions of 20 million batches. You're talking about enough for a certain amount of people over the, now, by the time we get, they said to the summer, they'll be to the point where everyone will have had it. And I understand by that point, sure, if you want it, you should be able to get it. However, that concept that, sorry, grandma, you stay home because, you can be just like us. I don't feel like you've ever dealt with anyone who is of that age and dealt with the situations at hand. They need help. And if you can't help them, if no one can come assist, this is absurd. This is absurd. I feel like those are people who should get it first. Hopefully we will see that. Hopefully there'll be such an outcry from these states that are authorizing this that you'll see that happen.
Right. And to your point, we're just talking about priority, the priority system within rolling this out. That doesn't mean that people down the priority list will never get it because they're producing batches. But we're talking about as soon as possible, as it's out there, get it to the at-risk. That should be the key to this. It's at risk to save the lives, and we understand.
That's why us at 35 aren't going to be able to get it until likely next summer.
Right.
There's a reason why that we have a priority list here,
and it makes sense.
Yeah, it's insane. I'm sorry, you shouldn't say stuff like that. That's ridiculous, and it's not because you're old enough to stay home. You're good at doing that. We need to protect these people, and a lot of these people need special care. It's insane. Give us a call, 1-800-684-3110. We got some phone lines open, 1-800-684-3110. We're taking calls on all kind of topics, especially coming up in the next segment. We're taking calls on the vaccine. We're talking calls about the UK. How do you feel about the UK getting it? I'm good for them for pushing it through. I do think that their version of the FDA, again, you're all talking about a lot less people, but their version of the FDA did push it through and got approved. That's the first in the world to approve the Pfizer vaccine, right, Will?
That's right. And they do assume that our FDA is very soon. Yeah. Very soon. And it's actually probably a good sign that the UK has approved it, because I feel like the more eyes you have looking at the data and everything is going to be a good sign.
I think the dates they were thinking for the US were like the 9th to the 11th, somewhere in that range is maybe when they may approve it. And then a lot of these places already have it.
Right, exactly, because they've been producing it. The U.S. government, as a part of Operation Warp Speed, ordered a certain number of batches from these companies in advance, assuming like, okay,
so there are
when
planes
you get
ready, and then even like these things, I think certain hospitals already have it. They're just waiting legitimately for the FDA to just, which they should obviously look into it, make sure it's safe, to say, okay, approved, and then boom, it hits the market.
Which is quite an impressive feat. When you look at, first of all, it's the quickest time in history that a vaccine has gotten to market. And the fact that the logistics of multiple companies that have similar vaccines that are before the FDA, but they're all mobilizing and getting ready to, and already moving batches, producing it. They are standing by the data they have and the trials they've done. They're getting it, moving it into place, mobilizing it. And then it's almost like a light switch will turn on when the FDA greenlights it, that they have these distribution centers, and a lot will start in hospital settings and things like that where there are people at risk that need to get it. But as well, I've seen that like local pharmacies, they've already started to set up the distribution channels and have the storage containers that, because some of these need to be well below zero stored at for these mRNA vaccines.
Very cold.
Yeah. So they have to have these things in place that it's not just like, okay, it's approved. Now you got to get a freezer. And now you got to get a plant. Like they had to get the supply chain set up.
Yeah.
And it's remarkable to think about.
Yeah, they really got it done quick. Hey, phone lines are completely full right now, but they will open up. I want you to call in. In the next segment, we're going to take as many calls as we can. So call in. Be nice to our phone screener. Okay? We're only taking on certain subjects. You're probably watching. You're probably commenting maybe on Facebook and on YouTube, and you're like, they're not talking about this specific thing. Well, that's just not one of our topics for today. So call in on one of our topics related today. So I'll give you something you can talk about. Talking about what's going on with the Russia hoax and Attorney General Barr and in Durham. You can talk about that. We can talk about the vaccine. But when we're talking about the vaccine, let's talk about either the UK getting the approval and what that looks like going forward, or we can talk about prisoners getting it before your parents, grandparents, or yourself, potentially, if you're over 65 and watching, which I know a large portion of our base is. Or what else was there, Will? We can talk about the Kentucky religious schools lawsuits. I don't think we've talked about that much, and that is obviously going on. Let's recap that a little bit. In Kentucky, it's going to potentially to the Supreme Court saying whether you can shut down religious schools. And we know what happened a couple weeks ago. Look, I know this is happening in a lot of places where there is this sort of confusion of what's allowed, what's not allowed. This store's open, but this theater's not, but this school is, but the movie theater's open here, but you can't do this more than 50 people. There's a lot of those laws happening. But in Kentucky, and honestly, we've seen such a little outbreak in schools.
Well, and I think we should actually play this bite, because this is from the director of the CDC, Robert Redfield, and this was just before Thanksgiving. It was actually in
Robert Redfield
with the not Robert Redford. Redfield.
I understood.
And he was giving an update, and this was right before Thanksgiving when New York announced all their closures that they have actually gone back on. But this is Bite 24, and it's really interesting in light of the order that came out from Governor Beshear on November 18. Let's hear what Dr. Redfield had to say.
The truth is, for kids K through 12, one of the safest places they can be, from our perspective, is to remain in school. And it's really important that following the data, making sure we don't make emotional decisions about what to close and what not to close. And I'm here to say clearly the data strongly supports that K through 12 schools, as well as institutes of higher learning, really are not where we're having our challenges.
Yeah, and I think, look, it's not unlike the toilet paper shortage. You know, you look at that and go, you know, why did that happen? It was an emotional response.
Right. We got to stock up.
And you feel like you have to be able to control something. So what they're saying is, well, we're going to control your school system, even if the data is not showing this. Look, if there's an outbreak at your school, absolutely. Shut it down. And lock it down. But if you're talking about a lot of schools, most schools, you're just not seeing it.
And the difference here is that the Attorney General of the state isn't actually going to the Supreme Court getting the governor to open the public schools. I think he understands that that's within the purview of the executive emergency powers of the governor in his state, even if it's ill-advised based off of the CDC's guidelines and what the director of the CDC was just saying there. But this is specifically for the religious schools that are remaining open. And he's saying this is a violation of their First Amendment rights. It's a part of their worship even to educate children in
when you start
these settings.
closing churches, when you start limiting religious schools, then you start really controlling a lot. And we got to make sure that we're there at least to help. That's what we do here at the ACLJ. We help you, and we help people who are in need. And whether that's people who are in need for legal assistance. Look, I know we've heard it many times. You can have some of the top lawyers in the world represent you when necessary in the ACLJ for absolutely free. We only can do that with the support of our ACLJ members and supporters. You can do that by going to aclj.org. Part of your matching challenge right now. That's if you give $20, $40, $40, $80, so on and so on. If you give a certain amount, another person on the other end says, I'll match that donation. So we appreciate that. Again, your gifts are doubled this month. Give today at aclj.org. Again, aclj.org. We'll be right back with the last segment. Hopefully a lot of phone calls. Jay Sekulow Live. Welcome back to the final segment of the Logan Sekulow Reprogram Takeover. Don't worry, I see your comments. The regular crew will be back tomorrow, so don't worry. You just got 8 more minutes with Will and I. But if you've enjoyed it, guess what? You can have 8 more minutes and more over on our YouTube channel. That is on youtube.com/Logan Sekulow Reprogram, or just search Logan Sekulow on YouTube. Click subscribe, ring the bell. If you're watching on YouTube right now, also subscribe. On all social media platforms, make sure you're following the work of the ACLJ. We release exclusive content for each one of those. So whether you're on Facebook or whether you're on Twitter, whether you're on Instagram, wherever you find our content, you can find it there, or you can go to my specific ones as well, because we put out new content every day. I'm sure I'll be going live later on today on our YouTube channel, so find us on youtube.com/Logan Sekulow Reprogram. We appreciate it. I did say we were going to take some calls, but I think we are still trying to get through some of those to find the ones, like I said, that maybe are a bit more airable.
Yeah.
There's maybe some people who've called in who are maybe a bit frustrated. Maybe I'm just going to give you some hints. In certain words you shouldn't say to the phone screener that maybe won't get you up there. Also, if they're off topic. Will, let's talk a little bit more about Kentucky.
We do have a comment real quick from Ben Alvarez, who on YouTube says, Logan brings a lighthearted approach to the show. I like that. We need to laugh and smile. It's healthy. So we're good medicine.
Well, speaking of good medicine, I'm not going to do. I see the comments. I'm not passing judgment, good nor bad, on whether you, again. A lot of people are commenting, you're talking about the vaccine. You should be I'm just talking, I'm telling you the news. The top news story of the day is that the United Kingdom has approved it. And maybe the number 2 or 3 story is also the prisoners are getting it first. Those are things that are happening in the world, people. I'm going to tell you about what's happening. We're not going to shelter our eyes from what's going on. It's a big deal. And honestly, I don't really have I think it's going to be interesting to see how things roll out. Do we see do we see mass immunization? Do people actually take it? I think that will be interesting to see, because a caller brought up, will schools require it? Well, I think certain places will require it. I think you're going to see, specifically by midsummer, to try to get live events happening in the same way they used to get full capacity things. And I think a lot of people are going to line up and take it. I think once it's at least shown to be effective, I think people will a lot more than maybe you're expecting. It may not be you, but look, understand there will be probably some give and take here. There'll probably be certain things you'll be able to do and certain things you won't be able to do unless you have some kind of medical exemption. Let's go ahead and take a phone call. I was going to go. It doesn't say that they're ready, so I was going to make sure that they are ready. Are they ready to go? Okay, I think my screening is just delayed. Let's go to Kat in New Mexico. Kat, you're on the air. Oh, did we lose Kat?
We lost her.
One call, Kat. I'm sorry, not your fault. Sound like you're calling from some form of Skype or VPN.
That's our phone system.
Oh, it does that noise?
When it's a drop, it's very lets you know that phone call was dropped.
I would like it to be a more aggressive noise. I would like it to be old school. You don't hear that anymore.
Like a line off the hook.
Yeah, you don't hear those noises. Those are noises of our childhood,
right? That we grew up on.
Yeah, your phone off the hook noise.
You ever you just asleep and all of a sudden you hear in your room, because the phone got knocked off the hook?
Oh, not now.
No, of course not now. You don't. There's not a place to hang up the phone. You just press a button.
Yeah, it's like when your fire alarm needs new batteries. You're like, it's always the worst time.
Why does it always do it at 2 a.m?
Yeah,
well, it's like, why can't batteries
I didn't
go
install
bad
this
at 10 a.m.?
Yeah, I didn't install this at 2 o'clock in the morning.
Right.
But I guess keeping people safe. Let's go to Sylvia now on line 6. Sylvia, I'll take your comment. Let's go ahead.
Okay, thank you. Thank you for taking my call. I'm not as specific as I would like to be, but I would like to say that I'm 62 years old.
Okay.
My mind is intact. I actually live in a nursing home. I'm in my second year, going on my third year, and we've had our civil rights violated, just trounced throughout this whole lockdown. And it's just absurd. And for somebody like that person that you read somebody's comment to say that, oh well, you can just stay home. That's just adding more insult to injury. Basically, I'm not even a second-class citizen anymore. I'm a third or fourth-class citizen. I don't matter.
It was very offensive, Sylvia. I think that's a comment that was incredible. Like, to me, I'm reading the comments, I'm going through, and I see a lot of your complaints and a lot of your comments, the good and the bad. But that one stuck out to me. This is someone who said, well, you know what? Give it to the prisoners. They're living in confined spaces. Don't worry about the old people. They can stay at home. I really am deeply troubled that may be some of the rhetoric that comes specifically from your more liberal-leaning friends. This sort of, that we live in a world where 4 or 5 years ago, we even have the medical professionals that Joe Biden is putting up there saying, maybe you shouldn't live past 75 years old.
Right, yeah. Zeke Emanuel.
I mean, those are real things that are happening, and that's the problem. When you start to prioritize criminals over our people like Joyce, people that are most needed, it really is a odd time. And that's why we do have to make sure that your freedoms aren't trampled. We need to make sure that you are protected. And if you want this vaccine and you are at that point in priority, you should be the high priority. And we're going to talk about that. We're going to talk about more stuff like that coming up.
Well, and Sylvia did bring up the fact that she feels like civil rights have been trampled during this time. And I know many states, especially more left-leaning states, I think that has been a very big concern from people. I mean, that's why we fought the singing ban in California. We filed, we're waiting to hear an outcome from the court in some of those cases still. But yes, even Justice Alito gave a speech before the holiday about civil rights have been affected.
You realize you're saying that the 2 presidential candidates this year, neither of them would qualify. I mean, yes, obviously they would be the president. They probably could get it. But if they weren't,
just straight based off of the age demographic,
that they're nearly 80. I got in trouble because I said Joe Biden was 80 and he's 78. I'm sorry, I rounded up. On that comment, they're like, Logan, you need to be more specific. He was 78. I'm like, okay. I rounded up a little bit. Let's go to Phyllis really quick in New York. I think a very important call, Phyllis. You're on the air.
Hi, I'm 80 years old, but I suggest before I have access to the vaccine, give it to the school teachers. The school teachers have been instrumental in keeping the schools closed. Take that away from them.
Okay.
Give them the vaccine, then they don't have that as an issue anymore.
Look, I think, Phyllis, I appreciate that. I appreciate that call saying, I want to protect the kids and protect the students. And I'm not talking about just from COVID. I'm talking about protect them even mentally. So that's an interesting thing. Well, I don't know if teachers do they fall into that sort of front line? I don't think they do. And I think that would be an interesting point of view. Yeah, if you get the teachers vaccinated, we know that kids are much less likely to contract or to, have severe issues from it. Well, then we get the schools back.
So they actually would be in that congregate housing or essential workers category, which is the same as the prisons category, because it's essential workers that have direct interaction with the public. And so that's, teachers, childcare,
great.
Even they put grocery store workers, which makes sense because they're seeing spread.
They're seeing you're seeing so many
because
people.
It's so much interaction with
the public. It's not
the
same 10 kids every day. Or 20 kids. You're seeing thousands of people a day.
Right.
So I understand that completely. All right. Thank you for listening. Thanks for tolerating the Logan Sekulow Reprogram takeover today. A lot more coming from us. So get ready. Coming in 2021, you're going to see a lot more of Will and I, and we appreciate it. Make sure you're following us on all social media. Make sure you check out the work of the ACLJ at aclj.org. Donate, because right now your donation is doubled. We appreciate that. Since you're not going to see us tomorrow, spend this last 20 seconds to say, I think you're going to like our show. You're going to like what we do. Here's what I'd like you to do. If you're the thousands of people that are watching or the millions of people listening at home, Go to YouTube right now, youtube.com. Search Logan Sekulow or just directly Logan Sekulow Reprogram on YouTube. Subscribe, hit that bell. We really appreciate it. We'll see you next time. Thanks for listening. The whole crew's back tomorrow on the Reprogram.